Please be aware that this webinar is registered and is also being recorded for future use on our communications channels. So I'd like us to begin because we have a lot to talk about and we have a lot of wonderful speakers to listen to. So let's begin with introductions. Today we have 5 cooperators with us from the health sector who will share their experiences and knowledge with us. So from Gulliver Social Cooperative in Italy, please welcome the Communications Officer, Alessia Bellino. Hi, Alessia. She's been a cooperator since 2006, and Alessia is committed to implement communication strategies that promote Gulliver to all their audience and stakeholders. Next, I'd like to welcome Dr. Carlos Zarco, who is the Director General of Fundació Espriu, and he is also the President of the International Health Cooperative Organization. Welcome, Carlos. And as a medical director in Madrid, Dr. Zarco has been working on the front lines of COVID-19 since the pandemic arrived in Spain. So if he looks a little tired, that's why. Next we have Mirai Chatterjee. She's the director of the Social Security team at SEWA, the Self-Employed Women's Association in India. Mirai is the chairperson of the Gujarat State Women's SEWA Cooperative Federation that consists of 106 primary cooperatives. She joined SEWA in 1984. Hello, Mirai. Next, we have Gilberto Quince. He is the health manager at COOMEVA in Colombia. COOMEVA is a health insurance and financial services cooperative. Gilberto has served in many roles, and those of you that know him well, was the president of Positiva Compañía de Seguros and also the Social Security Institute. Hola, Gilberto. And lastly, but not least, we have from Cameroon, Fadil Donkou Raouf. He is the president of the Alliance of Health Cooperatives in Cameroon. He's a general practitioner registered with the National Order of Doctors, and he's a busy man. Among many other activities, Fadil and his team are creating cooperatives in Cameroon to serve his communities. That includes a pharmacy cooperative and also an ambulance and home care cooperative. Welcome, Fadil. So those are our speakers. So before we begin, I'd like to ask you to help me welcome Bruno Roland, who is our ICA's Director General, to begin and to also offer us a few remarks.
So I would like to warmly thank the International Health Cooperative Organization, which is the sectoral health organization of the International Cooperative Alliance, or ICA, for co-organizing this webinar with us from the ICA Global Office. Why do we organize this webinar? When there are hundreds of webinars being held on the current pandemic all over the world? Well, this is because, together with ICO, we think that there is a specific cooperative way, like the title of this webinar is called. So the cooperative way in how cooperatives contribute and provide value to the communities in which they are embedded. And that is not only during the current pandemic, but also in health crises in general, and even beyond. This can also be extended to all types of crises. And this could be verified through a series of studies regarding the cooperative's resilience to crisis in the aftermath of the 2008 economic crisis. In fact, this cooperative way, as we call it, is always there. It's only that it becomes more obvious, more apparent during crisis. Before we organized this webinar, we obtained an important feedback from cooperatives in general and health cooperatives in particular through a platform that we launched. Incidentally, is a cooperative. This feedback, which we got on this platform, provided us not only with information regarding the situation on the ground, but also regarding precisely this cooperative way, which I was mentioning, and in particular, the democratic decision-making process through which cooperatives operate in communities, and the speed and effectiveness of this democratic process, which is particularly important, of course, in times like this one. I should mention that the very first cooperative that shared its experience on that Lumio platform is SEWA's Loka Swath Ya, which means people's health in Sanskrit. and one of the cooperatives that will be presented today. And I wish to thank Mirai Chatterjee from Lokaswaz-Ya for sharing her experience today, and also Fadil Donkou from Alliance Camerounaise des Coopératives de Santé on Cameroon's health cooperatives, and Carlos Zarco on Fundación Espriu in Spain, Gilberto Quinche on Comeva in Colombia, and Alessia Bellini on Gulliver Cooperative in Italy. Their testimony will show us that the cooperative way is really a global one. Thanks to all five, and thank you all for taking part in this webinar.
Thank you, Bruno. Next, before we start, I'd like to share with you a message from Ariel Gorko, our president, who couldn't be here with us today, but he sent a video message for us to share with our audience today.
Dear cooperators, dear colleagues, please let me start by thanking the International Health Cooperative Organization and the speakers of this webinar for launching the Cooperative Way webinar series of the ICA, focusing on the contribution of cooperatives in the health sector that has been in the front lines during this period of health emergency of COVID-19. Today, 3.65 billion people do not have access to essential health services, and 100 million are pushed into extreme poverty every year due to healthcare-related costs. At the same time, 100 million people are also seeing benefiting from access to care through health countries, filling existing gaps. Echoing the United Nations Secretary General in his 2019 report on social development, I agree that the potential of health cooperatives is far from fully harnessed, and it is important to better understand their role and their competitive advantages in meeting health needs in order to devise strategies for expanding services to broader segments of the population. To achieve this, I feel our common cooperative identity should be central to the global collective action for the recovery from the pandemic. As you know, the crisis is not over and has already manifested into several forms affecting the society and the economy. This could invariably further deepen the inequality across communities. Our cooperative value of solidarity, equality, and self-help, as well as the tenets of Principle 7, concern for community, are more relevant now than ever. I, along movement colleagues, strongly feel that cooperatives and cooperators are capable of reassuring the society and reinforcing and working towards equal rights to health and for social protection for all. Looking at United Nations SDG 3 on health and well-being and its vital role to the 2030 Agenda for Sustainable Development, we should acknowledge the work on health cooperatives in providing quality and affordable healthcare services to their communities. The question now is how to propagate and support the cooperative model in the health sector in an inclusive way. The diversity within the cooperative movement and its capacity to stand resilient and in solidarity with local and global communities, reaching those mostly in need, cannot be disregarded. In our General Assembly resolution in Kigali, we continue looking at effective multilateralism and multi-stakeholder partnerships as key to draw a new path on sustainable, inclusive, and just society for all. The global cooperative movement has weathered many storms and crises and can be a valuable partner for change in its own rights, a recognition that the European Union is valuing through the ICA-EU partnerships. COOPS for the framework within which this initiative is launched. I am sure the discussion today, listening to cooperatives that they lead by example in the health sectors within different regions, will motivate us all to enhance our support and contribution to the movement in these challenging times. Wishing you all great deliberation and looking forward to the outcomes of this initiative. We can do better together.
Wonderful. Thank you. Thank you, Andrea, for that. Thank you, Andrea GRUPO. So let's begin. We are going to start with Alessia Bellino from Gulliver. Alessia, the stage is yours. Oh, let's make sure. I have to ask everybody to be patient as we work this out. Thank you, Alessia.
Okay,
there we
now
go.
It works. Thank you.
Yes, it does.
Okay. Hello, everybody. It's a pleasure to meet you all, and I'm quite excited to be here, especially because I'm the first. So now I will start with a little presentation. And I'm from Italy. And my cooperative is called Gulliver, or Gulliver, as we say in Italian. And I'm going to present you some little slides so you can see what I'm sharing. I hope it works. Okay, here we are. This is the subject of my presentation, and I want to talk about who we are. We are a Type A cooperative that is a multi-stakeholder, is a Italian model that we call social cooperative, because we work with public institutions, we work with local health units, we work with other cooperatives, with private companies and foundations. So this is stakeholders, multi-stakeholders. And we design and manage social, health and educational services dedicated to the community and to the most needy, children, people with disabilities, migrants, and senior citizens. Gulliver was founded in 1996 in Modena, that is a town in North Italy, and we have almost 2,000 employees, and of which 16 are members, both workers and volunteers. We cover 3 regions in Italy. In Emilia-Romagna, that is our main area. We are in Piedmont, and we are in Lombardy for 300 and more services, and we took care of 9,000 beneficiaries in 2019. We have 5 areas of activities, as I'm saying before, and the health sector is made up by the elderly, the social support, and new entry that is a polyclinic that is new for us. We have 10 care homes, and I'm here just to talk about one successful experience that we have during the pandemic. That is, that starts here, the story that I want to tell you. At the end of April, we were contacted by a local journal and then from a national TV, and they interviewed us about the care home Cialdini. Cialdini is the name of this care home that we manage in Modena, is the biggest in town, and Cialdini was COVID-free during the first 2 months of the pandemic, and it still is, fortunately. So is a care home with 0 infections and 0 deaths by COVID-19. I don't want to let you see the service because it's in Italian, but I'd like to fix some points of what worked. I try to think about the most important things that we have done that worked out, and this is the point. The first thing, I think that we have a timely action. Immediately, we applied the strictly rules to the families for the visits, for families of residents. We have put down some restrictions and at the beginning of March, more or less, we stopped the visit. So residents were isolated in a certain way in the care home. The second thing that we have done is to redesign the space because the building was not adapted to isolation. So we need to mix it up and to reorganize. So we have isolation in private rooms for residents to be safe. We have closed the common areas. We have stopped the shared activities and everything, even meals and everything is in rooms. The third thing is that we invested a lot of hours and resources in training because our workers needed to be trained on how to wear devices, equipment, how to sanitize, how to avoid contagion between one shift and another. So we have 3 full-time specialists that online trained and update our workers. Other aspects that I want to fix with you is what helped us by circumstances, by something that not depend only from us. The first thing I think that is the small size of the care home, because in Emilia-Romagna we have a legislation that says that you can have maximum 70-80 beds per home. Instead, Lombardy, for example, can have 200, 300, 500, so it's very difficult to manage a care home with 100 people that 2 and more 100. The second thing is that we have more than 40 years of experience, and in the past we faced off some small, in proportion, little contagious infections, seasonal flus, and we have already some guidelines that we followed to face off this pandemic. I want to remember that a care home is not an hospital, but for a short time we had to behave a little as if we were, and it was quite hard for us. The third thing that I think that is flexibility, that is the cooperative way that we are talking about before, that is the big adaptation capacity to the change, because cooperative can invest resources, human resources, organization, etc., in a different way. And I think that is a very specific characteristic that helped us a lot. I need to add some observations because I want to underline that on 10 care homes that we manage, we can at last see that 50% were COVID-free and are today too. One in Piedmont and the others in Emilia-Romagna. But we adopted the same defensive strategy, and the staff was equally prepared and qualified as well. It not happened. We have workers affected by COVID and residents who were affected or even died. But there's something that we can't control ever. For example, hospital discharges without testing, substimated symptoms, no symptoms, potential contaminations from outside. So I think that everything that we can do to control the situation, we have to do, but there's something that unfortunately we can't. I wanted to finish with this nice picture that is the staff of this care home, and later I can do more reflections with you, but now I want to finish with this. This is a picture that represents the teamwork that they did. They do it well, and the force, the power of this staff was to be united, to be compact, to be resilient, and the director, the care workers, the nurses, the physiotherapists, the psychologists were all together to fight this pandemic. Thank you.
Thank you, Alessa. That is, and I can think of a few questions that we can discuss after, because that is a wonderful story. And it's a nice segue to our next speaker, Dr. Carlos Zarco, who I know can also speak quite well to this. Dr. Zarco, I invite you to take the stage.
Right now.
Oh, perfect. There we go.
You hear me well? Yeah.
Yes, very well. Thank you.
Okay, that's right. Well, first of all, I want to thank to the ICA General Director and the IHCO Secretary General for this opportunity to explain to you the way SPRIU Foundation have faced the pandemic and is facing right now. To tell you a little bit about the Spain background, Spain has been hard hit by the COVID-19 pandemic. The first registered patient was known on January the 31. A state of emergency and lockdown was imposed on March the 14th. At the peak of the infection, there were more than 900 dead daily. The ICUs were overwhelmed and some hospitals were on the verge of collapse. Fortunately, it seems that things are getting better. However, so far, there have been more than 240,000 confirmed cases. Some 124,000 have been admitted in the hospitals. Near 12,000 have needed intensive care units. And regretfully, more than 27,000 patients have died. Talking a little bit about what is a SPRIU Foundation, I want to share with you a few details about my organization. The SPRIU Foundation is a network of health COPs, hospitals, medical centers, insurance companies, diagnostic units, technology companies, and moreover, currently caring for 2.6 million people in Spain. For example, past year we registered more than 30 million consultations, more than 4,100 surgeries, more than 500,000 emergency services. The whole group brought together more than 180,000 cooperators, directly employed 6,000 people, and we achieved a turnover of 1.6 billion euros. SPRIU offers complete health services to our customers and members in 16 hospitals, 32 multi-speciality medical centers, and in partnership with more than 45,000 health professionals. Over more than 60 years, SPRIU's COPs have developed a non-profit health model based on the reinvestment of any surplus in knowledge, technology, or infrastructure to improve the healthcare quality. We have consolidated a strong public-private partnership with the national NHS and also developed a governance model for multi-stakeholder COPs where doctors and patients share the decision-making process. The response of our health COPs to COVID-19, the unprecedented health emergencies we have faced over the past months, has compelled SPRIU COPs to completely reorganize our healthcare services to be able to treat close to 12,000 COVID-19 patients. Once again, the cooperative model demonstrating our resilience thanks to the professionalism and commitment of the healthcare workers and all cooperatives, members and employees. We were able to handle the situation. All the action developed by SPRIU have been implemented following the guidelines issued by the World Health Organization and the Spanish health authorities. And since the beginning, we have been cooperating at all levels with the public health system. 2,600 COVID-19 patients had been admitted in our cooperative hospitals, where they had the priority because all non-urgent interventions, surgical procedures, and medical consultation were postponed. A new system of telemedicine and remotely delivered healthcare was launched instead. Hospital, we have to restructure our facilities and protocols, increasing the capacity in place, creating new intensive care units with a several-fold increase in some cases and reassigning professionals and tasks. Regarding employment, SPRIU COPs facilitated to non-health workers working from home to protect their health and guarantee their safety. In healthcare area, additional medical and nursing staff have been taken on to meet the increasing demand. Even some retired doctors came back to lend a helping hand. On the other hand, many medical doctors have seen their practice close because several weeks because of the lockdown. They have been unable to generate income to pay workers and invoices. SPRIU COPs launched an aid program aimed at help doctors to handle these financial issues. The concern for the community is one of our central values of the SPRIU cooperatives. In that sense, we have created a specific free telephone advice service addressed to all citizens. A team of the organization healthcare professionals, most of them voluntarily, provided guidance and cleared queries about coronavirus. To help people to cope with the lockdowns, we launched the website called Ahora más que nunca tranquilidad.eps, meaning keep calm now more than ever. It compiles helpful content concerning exercise, nutrition, mental health, sleep, and working from home, backed up by health professionals. COPs also set up flexibility plans allowing clients and users affected by unemployment or income cuts as a result of the economic effects of the COVID-19 to postpone the monthly payments. Doctors, nurses, and all health workers were in the front line in the hardest situation. They were working many hours under psychological strain to combat coronavirus. Unfortunately, some of them have been affected by the disease. The cooperative launched a psychological support program for health professionals to provide them with tools to manage the emotional stress generated by the emergency and protect their mental strength. The SPRIU COPs also joined forces with other Spanish firms to protect healthcare workers combating coronavirus by contributing to a solidarity fund set up by the insurance sector to cover them and their families. And I think that's a brief resume that the things that we have lived in this incredible, amazing, hard months that we have faced since March till June. It has been hard times, and I think that the Cooperative Way has shown its resilience, and we have done a lot of things that probably the NHS couldn't afford all the patients if we haven't been collaborating with them. I have all time to explain you whatever you need later, and that's all for me. Thank you very much.
Thank you, Carlos. I am sure everybody will agree with me that we're all very grateful for not just your work, but also for the workers in the hospital that you're at and everywhere in Spain and around the world. I think it's interesting because now, you know, we've been hearing from what goes on within the hospitals and the medical facilities, and now we'll take it out into the communities, which is always a very interesting topic for me. So with that, I'd like to invite Mirai Chatterjee to the stage and share with us some of her stories, and I know they're very interesting.
Thank you very much. And let me see if I can also share this with you. I hope I'm doing it correctly. Yeah. Is this okay? Does it work for everybody? So I am also delighted to be here with all of you, and I thank very much IHCO and ICA, and we are proud to be a member of both these organizations. I'll come straight to the context first before I speak about our health cooperative and what we did during the COVID-19 crisis, what we are still doing, because I think context is important. I'm trying to move this forward, taking a while, so maybe Andrea can help me. Anyway, while we're waiting for the slide to move, just to share that Our health cooperative is part of a larger movement of informal workers, almost 2 million informal workers spread across 18 states of India. And I mention this because perhaps it's a little bit different from the other cooperatives, because we grew out of the labor movement, and we operate by the joint strategy of union and cooperatives. And this has actually held us in good stead, both for our health cooperative, which grew out of this movement, and also because it helped, thank you, Andrea, it also helped with our relief work. So that's the first slide, and we were founded almost 50 years ago by Ila Bhatt, and we follow the values of Mahatma Gandhi. Very quickly, our organization also is a membership-based organization, and we gave, it has formed many, many cooperatives, including a cooperative federation, which was mentioned earlier. So I'm not going to dwell on this, but our health cooperative is part of this sisterhood of 106 women cooperatives. Next, please. Thank you. Just to give you a little glimpse of our sister cooperatives, because actually our response to COVID-19 and the relief work was comprehensive and holistic, and it involved all the cooperatives in the Seva ecosystem, not only our health cooperative. But now I think we'll go straight to the health cooperative. Next, please. Yeah. So maybe if we can just move that slide up a little bit. Yeah, our cooperative is about 30 years old and has 1,800 shareholders. And most of them, as you can see, are grassroots, women from the grassroots, either women who themselves are informal workers or their daughters, as you can see in the slide, future grassroots health workers. And we are mainly in the state of Gujarat. Next, please. Thank you. Yeah, just some highlights of what we do. We have been 3 main activities. We've been running 24/7, that is round the clock pharmacies outside large public hospitals in the city of Ahmedabad in Western India, state of Gujarat. We also run an Ayurvedic production center. Ayurveda, as many of you would know, is our traditional medicine system. So we have a license to manufacture well-being products, medicines, Ayurvedic products. I mention these because these, as you'll see in a minute, came in very handy during the pandemic. And third, we have a large community-based health program across 11 states of India with a strong focus on primary healthcare. We don't run hospitals, but we link up with public and private hospitals across different states. Next, please. Just to give you a little glimpse of what the pandemic is looking like today in India, I'm sorry to inform you that we seem to have been a late starter, but now we have more than 400,000 cases. The good news is that our case recovery rate is increasing. And also we have a low death rate at this time, 6.48 per million population. One of the mysteries of the pandemic, why South Asians seem to die less, but we're grateful. And we had 4 strict lockdowns. And as you can see, the pandemic has also resulted in a humanitarian and livelihood crisis of immense proportion. And I'm sorry to say our cases are rising, and so is our death rate. Next, please. So what did we do? As I mentioned, because we are a system, we are a movement with unions and various cooperatives. So our health cooperative already had a strong presence on the ground. So the first thing we did was to train 750 frontline workers, all women workers at the grassroots. We call them Agevan in our language. And they immediately began to send WhatsApp messages, voice messages, because of course door-to-door was no longer possible, nor were area meetings. So through new digital tools, they got the message out, simple do's and don'ts, psychosocial care, mental health care, also reproductive and sexual health and support for gender-based violence, which has increased significantly in India and perhaps in many other countries. We also provided food packets, as you can see in the photograph. One of our sisters is providing that. Government provided free food, wheat and rice, but other essentials like oil and lentils were missing, so that's where we came in. We also provided health kits, and here's where our health cooperative came in. We had a license to manufacture Ayurvedic products, and just before the lockdown, we got permission from the government to produce sanitizers. So on a large scale, we've been producing sanitizers, low cost, and soap, and from our sister cooperatives also, artisan cooperatives providing masks and so on. Our pharmacies stayed open 24/7, through most of the lockdown. I'll come to that issue of most during the challenges. And we also managed to get a lot of orders from the government because we were quickly able to manufacture, not only for our sanitizers, but also for masks and our vegetable cooperative supplying vegetables directly from the farmers. Next, please. Few more things that we did, just as Dr. Zarko mentioned, we were very much concerned about psychosocial care and support for mental health, because we're seeing increasing fear and stigma associated with COVID-19. And because our grassroots master trainers and Agevans, the grassroots women, had good trust on the ground, they were able to support people. We also managed to convince insurance companies to provide insurance cover. I must tell you, they were rather reluctant, but our cooperative bargained hard with them. And so several of our frontline women workers were covered. We also were able to get working capital. And as I mentioned briefly earlier, these are women who didn't have an Android phone. They're at the grassroots. Usually their husbands had an Android phone. So they borrowed their husband's Android phone and very quickly learned how to use digital tools for health education and health input. Another aspect of our work was facilitation between women and families affected at the grassroots and the government. As most colleagues from the South would know, in many of our countries, there's a big gap between what the government would like to do and where people are, and getting the relief measures actually out to where people are fast and in a transparent manner. And that's where we came in. We had these facilitation centers, which we call Seva Shakti Kendras. So we were able to keep those open and keep them like an information center open in the communities. And finally, policy inputs, which I'll come to later in the second part of this discussion. So I think I'll stop there, but I wanted to share quickly about some challenges, yes. So obviously lockdowns, and India had one of the most strict lockdowns in the world. Absolutely no movement, not coming out of your home for many, many days. And so obviously that's very difficult. Luckily we are an essential service, but still it was very hard for our sisters to get to work, to staff the pharmacies and so on. Obviously we had supply chain issues, how to get the raw material in this kind of a situation into our production unit. We kept our pharmacies open, but it was very hard for our colleagues because many of their family members felt they were unnecessarily putting themselves and the whole family at risk and did not want them to come to work. So that was a huge challenge, the staffing and so on. Another issue was that when we helped identify COVID patients, or when they were tested and identified as positive and were hospitalized, it was very hard for us to keep track of them because, of course, we were not allowed to enter into the hospitals. And then, as I've mentioned earlier, working capital has been a huge issue. And I think also messaging has been a big issue in India, perhaps all over the world, because this is a novel virus. But messaging leading to fear, stigma, all sorts of difficulties and conflicts, which we were seeing at the grassroots. And I've already mentioned psychosocial and mental health issues. In fact, we had to have counselors speaking to our team who were working outside the hospitals and so on, because they were obviously agitated and upset, as were their families. So these are some of the challenges we face, but I have no doubt that cooperatives will and have led the way. And later on in the second part, I'll share some of my thoughts on that. Thank you very much.
Thank you, Mirai. As always, the work that you and your sisters do in India is quite quite inspiring. Let me take this moment to remind all of you, our next speaker is Kinche. And for those of you, as like me, who I don't speak Spanish, and I will be switching over to the English channel to be able to hear Gilberto's presentation in English. And I invite all of you who are not Spanish-speaking participants to do the same. Thank you. Gilberto?
Muy buenos días y buenas tardes para todos en todas partes del mundo que nos encontramos ahora. Muchas gracias por esta invitación a la Organización Internacional de Cooperativas de Salud, a la ACI. Gracias a Andrea, Surada y a todos. Queremos compartirles esta experiencia nuestra de Colombia. Colombia es un país de 50 millones de habitantes en donde hay más de 3.000 cooperativas y un poco más de 6 millones de asociados a esas cooperativas, dentro de las cuales hay unas 100, un poco más de cooperativas de salud. ¿Quiénes somos nosotros? Comeva es una cooperativa multiactiva, cooperativa de médicos del Valle y de profesionales de Colombia. Nació en 1964, hace 56 años. Inicialmente se creó por 27 médicos y hoy en día somos 249.000 profesionales de Colombia. Primero fue solo en Cali, hoy en día es en toda Colombia. Tenemos 14 empresas, funcionamos dentro de 3 sectores: el sector protección o seguros, el sector financiero y el sector salud. Tenemos unos fondos sociales de casi 800 millones de dólares, con unos activos del grupo de cerca de 3.000 millones de dólares, un patrimonio de 480 millones y 11.800 empleos directos. Si le sumamos 3.000, 3.200 empleos que tenemos en las empresas de prestación que administramos conjuntamente con un socio norteamericano, con Christusel, serían 14.000. Una breve reflexión de cómo ha sido nuestro sistema de salud en Colombia. Tenemos 50 años, de los 40 a los 90, en donde pasamos de un sistema higienista a un sistema de la seguridad social con muy baja cobertura y con poco desarrollo de la infraestructura y de la capacidad profesional. Desde el año 93 tenemos la ley 100, llevamos 25 años en donde hoy en día algo que es de destacar precisamente en este momento de pandemia es que tenemos afiliados a 48 millones, el 96-98% de la población tiene un seguro, todos tienen un seguro repartidos en 2 regímenes. Uno que se llama contributivo, otro que se llama subsidiado, administrado por empresas promotoras de salud. Nosotros dentro de nuestras empresas de salud tenemos una empresa promotora de salud. También hay unas empresas de planes voluntarios de medicina prepagada, seguro privado. Allí tenemos también nosotros un poco más de 300.000 afiliados, de los cuales 150.000 pertenecen a nuestro grupo de asociados. Y hay lo que se denomina en Colombia IPS, instituciones prestadoras de servicios de salud, que son los hospitales, las clínicas, los centros de atención, que son cerca de 50.000, en donde, ¿qué datos tenemos importantes? 80.000 camas, 90, 100.000 médicos, con unas tasas que están un poco por debajo de la media, de modo que siempre estamos trabajando por aumentar esa capacidad. ¿Cuáles son los logros en estos 25 años? Pasamos de una cobertura del 18% que había en los 90 al 97% esa cobertura de aseguramiento que estaba ahora detallando. Y unos índices en salud en donde destacamos la mortalidad materna, que bajó de 104 por 100.000 nacidos vivos a 47 por 100.000 nacidos vivos. Y la mortalidad infantil se redujo también a la mitad, de 29 por 1.000, que había antes del 93 a 14 por 1000 que hay hoy en día, con un crecimiento de la esperanza de vida al nacer que pasó de 66 años a 76 años. Nuestro primer caso de COVID fue el 6 de marzo de este año y hemos tenido esta curva. Hoy en día tenemos 55.000 casos, fallecidos 1.700 y ya recuperados cerca de 20.000. La reacción fue inmediata. ¿Cómo articulamos esa reacción del país con lo que hicimos nosotros? Aquí quiero transmitirles estas decisiones que precisamente hacen parte de lo que es el trabajo colaborativo, de lo que es el comportamiento nuestro como cooperativa, como movimiento solidario. Prioridad, prelación a la seguridad, salud y vida de las personas. Actuación cooperativa, nuestras acciones son nuestro mensaje cooperativo, principio de solidaridad, de cooperación, generosidad. Confiamos y nos acogemos a las decisiones del gobierno. El gobierno empezó a generar medidas sanitarias, el aislamiento, el evitar reuniones, el cierre de fronteras, etc. Nosotros estuvimos siempre articulados en esa línea y para el caso de las empresas concentramos mucho el trabajo en gestión y liderazgo, no perder la visión de mediano y largo plazo, si bien estamos atendiendo la coyuntura, estar pensando también en el mediano y largo plazo, con una visión optimista, con confianza en el futuro. Aquí, como decíamos en nuestra actuación cooperativa, nuestras acciones son nuestro mensaje cooperativo. Mantener la calma, ideas claras, practicar la solidaridad y la responsabilidad. Tomamos unas medidas, todas formales, comunicadas a través de unos informativos, que los denominábamos comunicado 1, 2, 3, como lo ven aquí en la lámina. Estos primeros 3 comunicados, basados especialmente en las medidas de prevención, todas las recomendaciones de cuidado, de uso del tapabocas, de aislamiento, lavado de manos, y un comunicado especial para las empresas en donde empezamos a introducir algo que quiero que sea el mensaje a transmitir para todos nosotros en este gran movimiento solidario. El uso de la tecnología y los cambios en el comportamiento, en la prevención. Y en el uso de la tecnología para las empresas, el teletrabajo y la telemedicina para el caso de nuestras empresas de salud. Lanzamos en estos comunicados 5, 6, 7 y 8 unos paquetes de alivios. La mayor afectación junto al riesgo de salud ha sido la disminución de ingresos de la población, pérdidas de empleo. Entonces, generamos unos alivios para nuestros asociados, para los empleados o colaboradores y para la comunidad en general. Para los asociados, poco más de 15 millones de dólares en algunas condonaciones, en algunos aplazamientos de las deudas, en financiamiento. Para los empleados, un poco más de 730.000 dólares y unos alivios a la comunidad, sensibles con la situación de muchas personas en muchos sitios del país. A 19 ciudades fuimos a entregar mercados. Hemos entregado durante 5 oportunidades más de 16.000 mercados a más de 3.300 familias que hemos escogido a través de fundaciones en donde sabemos que tenemos que hacernos presentes también. En específico en nuestras empresas de salud. Entonces, la descripción muy sencilla, tenemos 3 aseguradoras, una EPS, la empresa promotora de salud que es de aseguramiento obligatorio, donde tenemos más de 1.600.000 afiliados, y una empresa de medicina prepagada y otra de emergencias médicas, más de 2 millones de afiliados en donde trabajan más de 4.000 colaboradores. Y unas empresas de prestación que administramos en conjunto con el socio Christus Health, las denominamos Christus Sinergia, 2 hospitales, 80 centros de atención, una empresa de hospitalización en casa con más de 3.000 colaboradores. ¿Qué hemos atendido? ¿A dónde tenemos que marcar un poco las atenciones para el COVID-19? Llamadas atendidas en nuestra línea especial, casos en seguimiento, más de 11.000, más de 9.000 pruebas realizadas, 1.160 casos confirmados, de esos 50.000 del país, 1.160 de nuestros afiliados, fallecidos 42. Pero también es importante resaltar que no solamente atendimos estos casos de COVID, sino que de esos millones de afiliados que tenemos, logramos atender durante estos meses más de 950.000, aquí tenemos en esta lámina abajo, atenciones no COVID, 959.000 solicitudes virtuales, casi 1 millón de atenciones virtuales. Ahí empezamos a ver ese cambio tanto en el teletrabajo como en la telemedicina. Hicimos más de 300.000 teleconsultas en todas nuestras empresas, lo hemos hecho, eso se ha venido quedando, lo hemos venido madurando, no solamente para la atención de la orientación telefónica, sino consultas propiamente dichas, tanto de medicina general como de medicina especializada. Entregamos más de 1,5 millones de fórmulas de medicamentos a nuestros usuarios, de las cuales casi 400.000 fueron entregadas directamente en el domicilio. Y hemos hecho 8,5 millones de atenciones a pacientes con cáncer, pacientes con enfermedades autoinmunes, pacientes con SIDA, pacientes con diálisis, enfermos de coagulopatías, pacientes con hipertensión, diabetes y otras enfermedades crónicas. Para cerrar esta primera intervención y seguramente ampliarlo un poco en el segundo segmento, entonces hemos revisado nuestro enfoque del plan estratégico que tenemos como MEVA para el 2024, cuando vamos a cumplir 60 años. Aquí nos hemos focalizado en reforzar la identidad cooperativa. Creemos que definitivamente el principio de solidaridad, la comunicación, el trabajo en equipo nos debe fortalecer para estos otros 50 años en que estamos inmersos de nuestra cooperativa, el desarrollo de esa comunidad de asociados, el buen gobierno corporativo, pero estamos ahora fortaleciendo en esta coyuntura lo que es la tecnología, tanto como nombraba antes en el teletrabajo, en la gestión administrativa, como en la teleasistencia, en salud, en la telemedicina. Y además hemos observado que lo que pretendía nuestra transformación de aseguramiento del sistema de salud de los últimos 25 años se ha acelerado, porque toda esta prevención, todos estos cuidados para evitar el contagio del virus no solamente nos están sirviendo para ello, sino que también nos están trayendo muy buenas enseñanzas para mejorar la situación de salud de los habitantes, para disminuir las complicaciones de las enfermedades crónicas, para mejorar la utilización de los recursos de salud. A veces se utiliza de manera inadecuada los servicios de urgencias. Hoy en día estamos viendo que se pueden resolver muchas necesidades de salud a través solamente de la teleasistencia. Entonces, tecnología, prevención, cultura, dentro de este esquema de modelo solidario, colaborativo, queremos que sea fortalecimiento de nuestro nuevo enfoque del plan estratégico COMEVA 2024. Muchas gracias.
Thank you, Gilberto. Gracias. And now I'd like to bring on our final speaker before we open up the floor for other discussions. Fadil, I hope we had some audio issues before with Fadil. I'm hoping they've been worked out, but let's give Fadil the stage. Thank you.
Thank you.
Perfect.
Good day to everyone. Okay. Good day to everyone, and it is a pleasure to be a panelist for this webinar and the ICE new initiative, the Cooperative Way. I have cooperative during COVID-19 and times of crisis. I am a Dr. Fadil Donkou. I'm from Cameroon. I'm the president of Alliance Camerounaise de Coopératives de Santé. Okay. Everyone, and as much as the wider world out there, we like to hear our experiences. Ladies and gentlemen, let us discover the Cameroonian experience during the pandemic period. To achieve our goals, we will present first our challenges in this pandemic period, then how we fill gaps during this context of health crisis, and finally, the impact of our actions. The cooperative movement in the health sector in Cameroon is very embryonic. It starts around 2017, and the Alliance Camerounaise de Coopératives de Santé brings together 2 health cooperatives only. SODIMES for the distribution of medical inputs and local health care, and Santé Assurée COPCA for local community health in Africa. Beneficiaries of services in the far north region of Cameroon are about 2,100 people actually. We face many difficulties now. The state structure involved in the creation with reference to the Ministry of Agriculture and Rural Development, MINADE, and the Ministry of Small and Medium-Sized Enterprises of the Social and Handicraft Economy, and the Ministry of Public Health does not have enough knowledge or does not have enough master about this new concept. Administrative difficulties in upgrading members' knowledge, as well as the administrative slowness in the creation process. Before starting my speech, I want just like to recall the situation of COVID-19 in Cameroon. We had 9,864 total cases, 4,018 active cases, 5,570 recovered, and 276 deaths, actually. Following the confirmation of COVID-19 cases in March 2020 in Cameroon, the Cameroonian government launched the implementation of barrier measures, including compulsory hand washing for all, infrared thermometer in all schools, compulsory wearing of masks. However, these measures were applied only at the central level, not at the outskirts. Cooperative immediately began mass production of homemade masks, production of hydroalcoholic solution according to the WHO standards, which were distributed in schools and public services. Infrared thermometer and equipment for washing hands were purchased and made available in schools and markets in collaboration with the GIC of rural women in Mokolo. Health personnel involved in various cooperatives have given their time in the public health facilities to manage the influx of patients. With the assistance of the health district of our locality, we create a screening center. The screening station at the entrance of the town for all passengers coming in or leaving the town. The members of all of the cooperative Santé Assurée COPCA essentially were volunteers and contributed for the sustainability of the activity. The current period of COVID-19 pandemic has enabled us to realize many challenges to be in our Cameroonian context. Before talking about the question on how cooperatives fill in the void during the COVID-19 period, it is first important to question the role of cooperative societies in our environment. I can say that the cooperative spirit is still not well understood or accepted. People who inherited it find it difficult to share it because the Cameroonian society is essentially based on capitalism. Cooperative values are poorly mastered by the public and the cooperators themselves. Cooperative education is not guaranteed in Cameroon. The cooperative as a major element favoring mutualization and social cohesion is the key element leading to economic resilience. Health cooperative face challenges to fill gaps, especially in this system, which does not facilitate their development. During this pandemic period, health cooperative observed challenges in several areas. First, education. The local population and the government had no master on the role of cooperative in our environment, especially in this pandemic period. The level of knowledge of the population was very low in terms of COVID-19, and the language barrier which hinders communication. Economic, the whole world was surprised by this pandemic. The cooperatives were not prepared to face it, and we had difficulties in mobilizing funds for the response. Funds which, for the most part, meant from membership fees. We had trouble acquiring wash material. We have people trained for the manufacture of hydroalcoholic gel, but we are financially limited for the production in sufficient quantity. Another problem is habit and behavior. The belief that the COVID-19 is a pure invention or even a myth, which hinders the respect of barrier measure, particularly social distancing, the systemic wearing of masks, and the massive regrouping in the market and public places. And then we lack resources, lack of shortage and of drinking water. To fill this gap in the health sector, we proceed in the field as follows. As the Education Center, we organize awareness campaign to create awareness on the role of cooperative within the community. And it is in this slide that we have a meeting on July 17, 2020, during the commemoration of the World Cooperative Day, to continue informing population knowledge of COVID-19. We hosted programs that were translated into the local language on the community radio called Echo de Montagne. The themes of which were general information on the coronavirus, hand washing, wearing of masks, coronavirus and us, breastfeeding and the COVID-19. There are another solution there. We launched a special fund, COVID response. Each cooperator contribute a sum for the production of masks, hydroalcoholic gel, soap, and infrared thermometers. We raised awareness on community radio and then gave practical demonstration during our visit to the population on the process of getting potable water. Thanks to our action, the population is more informed. The role of the cooperative is more and more particular particular within the population of the propaganda that we carry out individually and as a group within the community. We reached about 6,000 listeners during our intervention during the radio broadcast. Concretely, we donate masks at the regional delegation of public health, to the regional hospital annex of Mokolo, to the community radio Echo de Montagne, and the Mokolo Health District. We also share wash, mask, and material at the Association of Rural Women of Mayo Chanaga Mokolo branch, which bring together several community initiative groups. On the June 12th, we raise awareness and distribute the masks to the refugees of Minawawu camp during the cardiovascular disease screening campaign that we organized with the collaboration of Ministry of Public Health. Okay. This, you can see the picture that here, our program on community radio Echo de Montagne, and the round table with community and public authorities as part of our weekly program, Health, Education, and Life, every Saturday. Okay. Awareness section of the role of health cooperative in the region, the regional annex hospital in Mokolo. So thank you for your kind attention.
Thank you, Fadel. So we don't have that much time, but I cannot let this, this time pass without at least bringing a little bit more into the discussion. But I wanted to offer a brief observation, which I think will tie a lot of this together for all of us. And in the common theme that I've heard from all our speakers today is not surprising to me. And what I heard was there's the ability from Alessa, when you spoke initially, the speed and the innovation that happens, you know, within our cooperative world when we're faced with emergency. That seems to be a common thing, not just with Gulliver, but with throughout, right? And then of course, the kind of care that we give, Carlos and Mirai, that we hear from the community, which is also something very familiar within our cooperative identity. And of course, that the cooperation on cooperatives throughout, like at CEWA, it's not just the healthcare cooperatives, but you tie it in with all the other cooperative sectors. And of course, the solidarity, you know, all these are very familiar to us. And of course, and that's all based on trust. I think we all can agree with that. And because we don't have that much time, I feel like we can have this discussion for many, many, many hours. But what I would like to do is something I don't think we've touched on explicitly, is the relationship. Well, two things. One is, of course, how does the cooperative model within the health sector, how can that contribute to communities, you know, in times of crisis, like what we're in right now? So I'd like to pose the question of, because not everybody operates, not all communities operate within the cooperative structure. So, so I'd like to talk a little bit about the future, and Mirai, if you don't mind, I'm going to put you on the spot here for a little bit to talk about a couple of things. One is, of course, the how we can overcome these types of challenges, but also, in addition to that, the kinds of partnerships that we all have to develop with the government, with local or the federal government. So can you share a little bit of your experience with that, and maybe in the direction we can?
Absolutely, thank you very much. Just to say that I think one of the great lessons of this pandemic and the response to it is the importance of local action, decentralized action, community action, and that's where cooperatives come in. In states, in some of our Indian states, like the southern Indian state of Kerala, which had a strong community action through cooperatives, through collectives, through cooperative action, they were very quickly able to not only provide services, but to monitor, to support, and so on. So I think one of the big lessons for the future, and I'm afraid there are going to be more zoonotic diseases and pandemics in the future, is that we need to be more prepared, and who could be better prepared than cooperatives? We have a presence on the ground, we are trusted by people, as you said, and we can move fast. And since we are close to people, since our members are also at the grassroots, we can understand their needs and their reality, and we can also communicate quickly with them. So I think for all these reasons, it is the cooperative way. And we have no doubt in India that if we have to rebuild our economy and society, then it will be through cooperative and collectives in a decentralized and local manner.
Thank you. And on that note too, I'm very, and I'm sure we all, you know, we all live within our homes and communities and now in confinement. But to hear stories from hospitals, you know, what the frontline workers are doing. Dr. Zarko, I'd like to invite you to maybe talk about, I mean, you mentioned about how we all have to also take care of our health workers, which is, I don't think that we hear very much about, because we always talk about, what we hear is the health workers helping patients from getting more sick and from dying. I'd like to sort of examine you know, how is it within the health cooperatives or within the world that you operate in, how has that affected the not just the quality of the work, but also to keep the workers working? And how is that, say, different within the health cooperative model?
Well, it has been tough to do that because we have a lot of people, health workers, which was really affected by the coronavirus. In my hospital, for example, we are 500 people, and we have more or less 150 which were ill by the coronavirus. It was tough and hard because, as Mirai said, we were not prepared. We don't have enough PPIs. We think that China was so far away. And later we saw it in Italy, and the people doesn't take care about that, neither the politicians or the governments. And we'd have to do the best we know, but in the very first time, we don't have enough amount of protection equipments for the people. Then it was very hard to face every day because when I say some of the hospitals were on the verge to collapse, one of them was mine. the last days of March, I went home at the evening and I say it will collapse tomorrow, but fortunately then it doesn't collapse. I think we have to learn about it, but I have so many doubts if the people are going to learn something about this, because here we see the virus is less virulent right now. The people are going to the streets, they are not keeping the social distance. And I don't know if we have another peak in the next fall or not. But since we don't have a vaccine, this normal situation or a normal situation, it will be very difficult to afford, because I think we forget very soon the things that happened only 100 years ago, but we have forget the things that happened only 12 years ago when we have the infection of the pandemic by SARS-CoV-1. And only the places like Hong Kong or Singapore has been prepared to afford the pandemic. I am not very optimistic about that. I'm sorry.
Well, you are very close to the problem, you know, so that's quite understandable. Not very many people are in your position.
Yeah, I have the very everyday view, and we have
Yes.
we are much better, but we don't see, because I don't know if the papers of the news in TV news they haven't seen any kind of dead people. They are always talking about things like graphics and things like that. And I think the only one who had some of his relatives who has the dead will have something to do. Other people think this is another thing that the people are making me worry about, things that are not so much great. I don't know if this is the right way to afford it. And I say that the only two professionals that they haven't afforded in Spain, for my opinion, well, they are the politicians and the newspapers or the journalists.
So I'd like to take that on following up on that a little bit. And you know, it has been a very challenging few months for all of us, whether you're a doctor, whether you're a mother, whether you know you're a worker. I'd like to open this up a little bit more, and this is I'm going to go into the questions from the audience. We had many participants register for this webinar. And we had more than 100 questions submitted, and we certainly cannot answer all of them, I regret. But I would like to select a few that I think would be good for all of us to hear, and I think would find interesting. And going back to what Dr. Zarco was saying, in that, you know, there's so many sad and unfortunate situations and stories that have come out of COVID-19. I'd like to ask, you know, how can we, as members of the cooperative movement, how can we turn this? And this is a question that came in from an audience, from one of the registered attendees. How can we transform the negative effects or the negative impacts of COVID-19 into an opportunity from the cooperative standpoint? And you know, I would like to, Alessia, I'd like to hear from you. We talked a lot about the speed and innovation that you know, that resulted from this, which is quite normal for us in the cooperative world.
Yes,
can you share some of your thoughts maybe on how maybe we can turn this into a good thing?
Of course, because I want to make some examples, some concrete example, because about our story we can we can go on, and I tried to do what you are asking me, transform difficulties in challenges, because I think that is the key for Cooperative Way to increase our activity. Sorry. Okay. Okay, we're here. And our difficulties, the first one is PPI supplies. We have no lack of personal protective equipment, but it was hard to find them. And the high cost was not expected. So what we have done, from the right column, I'm going to from the left, I'm going to the right. And we create a team. We called it emergency team. And my colleagues looking for providers, public entities, donors, volunteers, new suppliers, just to search equipment for our care home and for all colleagues. And another point very important is that cooperatives can influence the politicians and the policymakers. And so we discuss a lot, and at last the region, Emilia-Romagna, I talk for Emilia, will in part refund us for the PPIs both. The second difficulty, the second problem that we had was psychological consequences of isolation. As you said before, isolation was hard for residents at first, but later for our workers and families. So these difficulties became something new. We create a team of support, psychological support for free, dedicated to workers and families. And we have 3 expert psychologists, and they were available by phone to help, give advices, listen to people, and trying to help by distance. And we had a lot of calls, and it worked. It worked for workers and for the relatives. The third was lack of communication and human contacts. And people were worried, were frustrated, were angry, even mad at us sometimes, but they are conscious of the risk. So we try to reduce the social distance with the technology. And so we bought some tablet, a new tablet, one for every care home dedicated to COVID-19. And we started to do video calls, video meeting, to send and receive photos daily for residents by nephews, daughters, sons, and it was very nice. It worked a lot. I just want to show you some promotional card of our services. Sorry, are in Italian, obviously, but pictures can help us to see how residents are so happy and grateful for this opportunity. Some of them are 19 years old, for example, and they can share with the relatives the meal moment, or on the sofa, on the bed, on the wheelchair, and it was a great opportunity, and they really appreciate it, and it worked very, very good. At least we are grateful for this period, not for COVID-19, obviously, but because the very hard work of our employees, we really appreciate it. They carried on their shifts with passion, dedication, and commitment, even they were tired and stressed and worried. The strong support of the cooperative was able to manage to organize and give resources to everybody in emergency, at every hour, every time of the day. If you need something, the headquarters can help you and listen to you and try find a solution. And the third, as says Mariah, is the families' trust in our capability, because families trust in us. They believe that we can do the best. And it's a good relationship that we have found out after this moment. So the cooperative way, to me, is not only how we take care of our work, but also how much we care about it, because persons are at the center of our action.
Thank you. Thank you. Thank you, Alessia. Now, I'd like to go back to the issue of trust. And you know, we, of course, you know, we hear from Mirai with the women, the strength of the women in India within the cooperative movement, and you know, here with the families, and I think what I'd like to be able to tie in also is the youth, and Fadil, I'd like for you, if you can, help me answer one of the questions that and from maybe from your perspective, from one of the questions that was submitted to us, from the audience is that how we within the health cooperatives and everything that we've listened to today with all the solutions, and there's the issue of trust and community work. Can you talk a little bit in what's happening in Cameroon and with your work? Because you are establishing health cooperatives. That's part of your work that you're doing in Cameroon. What are you doing with the government, the local governments there? Are you doing any activities within to work with you to establish these health cooperatives to help the communities that you serve?
Okay. Actually, in Cameroon, we think that we are going to join efforts together to achieve something, and then the first thing is the expertise, and then thanks to partnership with other health cooperatives around. Actually, we have only 2 cooperatives, SODIMES and health cooperative, and we asking Corinne. Okay. We aspiring to be great, and then we ask training, creation of cooperative schools in Cameroon that can help us to support, and then we need support for the international organization of health cooperative to influence Cameroonian policies and government. Then also we need training of cooperators in cooperative universities. There is a lot of problem, this problem of mentality that we have to change our behavior and our customs, and then to understand very well the role of cooperative in our society, to do something good like I see in Italy and Colombia and elsewhere.
So we are learning from each other.
The government is not very the cooperative seriously like other sectors that I see.
Okay, well, thank you. Now, now we have, I've been told by Andrea that we can run over a little bit. So it is 8:30 and it is the time for us to end, but I would like to at least ask one more question before I'm told to shut everything down. And I will open this up to all our panelists, all our speakers, and whomever would like to respond. This is another question from an audience member, which I think is a good one, is that what do you think cooperatives have learned during this pandemic? I guess we can do a raising of the hand with the old-fashioned way. Gilberto, very nice. Oh, hang on, Gilberto, momento. Let's switch.
Gracias, Zoraida. Muchas gracias. Yo creo que ese aprendizaje, el aprendizaje de este momento es fundamental. Aquí hemos conversado en Colombia y en Comeva, nuestra cooperativa, que definitivamente ha sido una oportunidad, así como es una situación crítica, difícil desde el punto de vista de salud, económico. Para nosotros, para el modelo solidario, definitivamente ese es el gran aprendizaje. Ayudando, nos ayudamos. Es uno de los lemas que tenemos. Al ayudar a otros, nos ayudamos todos. Y además, cooperando nos hacemos más fuertes. Tenemos ese aprendizaje de la solidaridad y como herramientas concretas tenemos la telemedicina, el teletrabajo, es decir, la tecnología en favor de esa solidaridad, de ese trabajo en común, de esa ayuda a otros. Pero, y además, el fortalecimiento de una cultura de la prevención. Tenemos que lograr aprender de esta situación, que hay que prevenir. No es solamente lavarse las manos y evitar infecciones, prevenir es ahorrar, que es lo que nosotros promovemos además en las cooperativas. Es generar acciones en estos momentos presentes para mediano y largo plazo, para el futuro. Esos son nuestros grandes aprendizajes de este momento.
That was perfect. Thank you, Gilberto. It is interesting because technology, you know, we all can do this now. Mirai, yes, I see you raise your hand, Mirai. Go ahead. Hang on. Yes, and you have to unmute yourself first, Mirai. Hang on, we can't hear you. Oh, there we go. No, that's right. Go ahead.
Yeah. So I think in addition to what has been said, preparedness, I think our cooperatives will try to be as prepared as we can, learning from our mistakes. Totally agree that we have to convert challenges to opportunities. I think we've also learned the importance of partnerships with government and others. And because as cooperatives, we have a structure on the ground, it's easy for government and others to partner. Two quick other things, the importance of having frontline health workers who can be agile and move fast and respond and enjoy trust. And finally, in a country like ours, digitalization. People adapted quickly, but we also understood that we still have a big digital divide, especially for women in formal workers.
Yes, and it's interesting because it's, and my question, and Dr. Zarco, I see your hand up, I'll get to you in just a few moments, but in my question is what can cooperatives learn from this? And I think, Mirai, to your point, I think it's also what government and our other partners can learn from cooperatives, yeah? So maybe we can open up those communication channels a little more to open the door, basically, to have them come to us and say, hey, what can we learn from each other? Dr. Zarco, we have maybe another 2 or 3 minutes, so the floor is yours.
Okay, thank you very much. First of all, I agree very much with Mirai, because I think that health co-ops, one of the conclusions will be that health co-ops are efficiently manage economic resources of workers. Recent studies confirm that health co-ops have grown in importance over the last 20 to 30 years in many countries, and the growth has been a reaction to the increasing demand for health services. And the pandemic is the main situation of that way, because they have grown difficulties faced by the governments and countries to manage rising healthcare expenditure. And we can be a very good partnership with the public or private sector partnership. And also, I think that the COPs are economically viable business and socially responsible as well. We have a long-term view seeking social, economic, and environmental sustainability, because the only investor that must pay back is our communities. Mm-hmm. And the profit that we generate every year is often fully reinvested, improving the business capacity to be more efficient, to provide better health services, and to allow better working conditions for health professionals, thus ensuring the cooperative sustainability. The other things like, I say, technology has come quicker, faster than before, and it's going to stay forever here. But I think that COPS has a great opportunity to show his strengthness in this after this pandemic.
I totally agree. And what's interesting also is that the perception of cooperatives sometimes in the world is not associated with being agile and fast and innovative and forward thinking. And what we've heard today here is just the opposite. I think hopefully we'll be able to dispel that perception, or the misperception, I should say, yeah. So like I said in the beginning, this is a topic that I know all of us here this is not enough time. But my hope is this can at least hopefully begin the discussion for more discussions. And I think we can also agree that there needs to be more communication with not just within us, within the cooperative movement, or in this case, just within the health cooperatives, but also with potential partners, with new partners, maybe partners that we've never reached out to before within the government, within the private sector. So I encourage all of you and all of you attendees today, and let me look at my count. We've had a very healthy amount of attendees today, which is a very good sign, especially since this is our first of the series that we're planning to do to promote the Cooperative Way, which I'm very proud to be part of. We did have some closing remarks from the speakers, but I'm afraid we've run out of time. So here's what I think we're going to do. This whole webinar is going to be made available. It's going to be posted, and I believe my colleagues are telling me, on the ICA YouTube site, which will include the presentations and of course the recording of all of us today. So I invite the speakers, if we have any closing remarks, we will record or figure out. We have the technology, it seems. So I would like to invite all of us to maybe participate in that way, if you don't mind. I think it was much more productive to have a conversation with everybody and to hear what the audience wants to hear. And I thank everybody for coming. And we're in many cross time zones, and I truly appreciate, on behalf of ICA and on ECO, I truly appreciate everybody's participation, and my speakers. I'm in awe of all of you and the work that you do. Thank you very, very much for coming today. Thank you. And with that, I think we will conclude. Thank you, Andrea.